So now we are going to talk about the pharyngeal cleft. Yes, what is a pharyngeal cleft? As we have seen in the early images that pharyngeal cleft is ectodermal. What you have to remember? Yes, ectodermal indipping. Yes, ectoderm was going inside between the two arch. Ectodermal indipping in between two arches, or you can say in between two mesoderm, known as the pharyngeal cleft. So what you have to remember for the MCQ? Yes, ectoderm. First MCQ. Yes, what another you have to remember, that there are the 5 arches are persisting, so 4 clefts persist. So these are the other basics MCQ. Now see here, these are the 4 clefts. Now what these are doing? Can you see this image from the standard Langemann embryology, that the blue color, I told you the blue color means ectoderm, the yellow color is indicating the endoderm, here the brown or you can say reddish color is indicating the mesoderm. So can you see, this is the first arch which is running horizontally, then second arch running horizontally, third arch is running horizontally, fourth arch is running horizontally, and very small amount of the sixth arch which is not properly represented here. Now see here, the outer one is the cleft. So can you see in this image? Yes, this is the first cleft, blue color. The first arch and the second arch, in between them there is the first cleft. Now see, between the second and third there is the second cleft, then third cleft and the fourth cleft. So these are the fourth cleft. Now see in this image, there is a rapid growth of the second arch. Yes, rapid growth of the second arch. This rapid growth of the second arch is going to meet from the lower tissue in the pharynx region. So what is happening during this all event? There is the formation of one gap in the neck. This gap in the neck is known as cervical sinus. The gap in the neck is known as the cervical sinus. It is present in each and every embryo. In us also at the embryonic life it was present. But later what happens? This part is totally filled by the tissue. So this all the gap in the neck disappear. So what I want to tell you? Yes, the second, third, fourth cleft disappear except first. First cleft only persist. Okay, so yes, you can make the notes. First cleft persists, while the second, third, fourth, obliterated by rapid growth of second arch, and during this rapid growth forms cervical sinus in embryo. So one thing you can remember, that this structure form cervical sinus, second, third, fourth arch, sorry, second, third, fourth cleft, they forms the cervical sinus. While what is happening with the first cleft? Yes, this first cleft is making, can you see, the first cleft is making outside any depression. So just observe this pharynx region. On the outer side, on the ectodermal part, is any opening there? Yes, on the upper side there is the one opening is situated, external acoustic meatus. So external acoustic meatus is nothing, it is formed by the first cleft. So this first cleft is making the external acoustic meatus, rest all cleft disappear. So prepare your notes. The first cleft persists, which forms the external auditory canal, or you can say external auditory meatus. So this is your MCQ. Now correlate with your ENT. Around this external acoustic meatus or around this first cleft, there is the development of the 6 hillocks, and they gets fused and forms the pinna. So in this way there is the development of the pinna as well as external acoustic meatus. Sometimes these hillocks are unable to develop. Okay, so that gives rise to the anotia, absence of the pinna. Sometimes yes, it forms the very small structure, then the patient presents with the very small ear pinna, that is the microtia. Okay, so these all are the various terminology which you can correlate with your embryology and anatomy. Now see here, all these clefts are making the cervical sinus, but it disappear. Sometimes it persists, sometimes it persists, and if it is getting persistence in the pharynx region, yes, here in our body there is the no opening, only one opening, but here there is a no other opening. Sometimes few patient comes with the external opening along the entry border of sternocleidomastoid. Can you see this image? Yes, this is the first cleft. Other all are getting disappear, but sometimes it may persist. So these may persist as the second cleft, third cleft, or the fourth cleft's remnant. Sometimes, not always. Okay, so what I want to tell you, the second just behind the angle of the mandible, third in middle of the neck, okay, in front of the sternocleidomastoid, and the next one more cleft is persisting at the lower part, and always these are present along the anterior border of sternocleidomastoid. Can you see? Yes, first, second, third, fourth, these all are always present along the anterior border of the first cleft. So any patient is coming to you with the history of any abnormality in which you can see any opening outside in the neck along the entry border of the sternocleidomastoid, that may be the presence, persistence of this cervical sinus.